Hey, everybody. This is Nurse Eunice for tonight's Wednesday Night Live. We're covering the body systems because we can never stop talking about anatomy, physiology, diseases. Your patients are going to be impacted by the care that you provide, and we need you to be knowledgeable. So, as we do in each of our videos, we're going to give you about 10 seconds to receive your notifications before we get started. And for everyone who's in the chat, hello. I won't be able to monitor the chat until the end so that we can get through our live stream without any interruptions. So let's get started. First, we're going to discuss understanding the body systems. Even though CNAs don't diagnose or prescribe, your care directly impacts systems like the skin, lungs, and heart. Knowing what's normal helps you spot when something isn't. Here are a few reasons to learn about the body systems. Number one, CNAs provide hands-on care that affects every body system. Second, understanding basic anatomy helps CNAs recognize normal problems versus something that is abnormal. Next, it improves communication with the nurses and the healthcare team. And then lastly, it can help enhance resident safety and dignity. So it's so important for you to understand the body systems. There are 11 body systems. So we have the integumentary system, and as a CNA, your role would be to prevent pressure sores, assist with hygiene, and observe for skin breakdown. Next, we have the muscular system. So as a CNA, you would help support with ambulation by using those gait belts and those DME, maybe the canes and the crutches. You'll be providing ROM or range of motion exercises. Plus, if they don't move it, they lose it. So you're going to help them exercise so they can prevent muscle atrophy. Next would be the skeletal system. Your role as a CNA, yes, we want to prevent those falls. So we're going to use the right safety equipment, such as gait belts and non-slid shoes. You're going to help protect your patients from falls, especially if, because of their diagnosis, they are more prone for fractures and falling. The nervous system is also a major body system. And as a CNA, you're going to observe changes in alertness, assist dementia patients, and ensure safety. Something that a lot of CNAs don't talk about, even though you'll say a patient has diabetes, you don't talk about the system that causes the diabetes. So that'll be the endocrine system. And so that will, whenever we talk about the endocrine or hormones, so be aware of your diabetic care plans. Observe for sweating or shakiness, because that could indicate that your patient is having a problem. The cardiovascular system, yes, you're going to be monitoring the pulse and the blood pressure. You're going to report swelling, and you're going to help monitor patients who have congestive heart failure. In other words, their hearts aren't pumping properly, and it's going to cause them to retain fluid. Oh, we're going to discuss a lot today, so let's keep going. The lymphatic system is also referred to as the immune system. Think about all the respiratory issues that your patients could have, especially when they're in confined quarters like in a nursing home. So your role as a CNA is to prevent infection, follow the standard precautions, and also the isolation protocols. The respiratory system, you're going to help position your patient for easier breathing. You're going to monitor their oxygen saturations. You're going to assist them to sit up, to cough and deep breathe. And yes, I know this kind of goes with the digestive system, but you're going to prevent aspiration. So let's go to the digestive system. As a CNA, yes, you're going to assist with those meals. You're going to monitor bowel habits, and you're going to report nausea and or vomiting. And as I just stated, if your patient is at risk for aspiration or having the food or fluid go into their lungs instead of their stomach, you're going to be assisting with meals, making sure they're sitting upright. And if they have a parade meal or if they need thickened liquid, you're going to follow that plan of care to make sure that your patient has the right diet for their health needs. The urinary system, you're going to record the I and O, that's the intake, what goes in, and the output. You know, something I say in every one of my videos is that what goes in should match what comes out. So if your patient has drank maybe 3 cups of water for breakfast. By lunch, I need to see an equivalent amount of urine in a collection device. So you are vital in recording those I&Os. It helps us know if the patients are dehydrated, if they are retaining fluid, etc. All right, so let's go back. Urinary system. You're going to record the I&Os. You're going to perform peritoneal care and catheter care. Remember, as a CNA, you don't insert the catheter, but you are responsible for taking care of the external part, the part that's out. The reproductive system, you're going to maintain dignity during peritoneal care, and you're going to understand age-related changes. You're also going to assist with toileting. And so you, as the CNA, are the eyes and the ears for the nurse. If something is off, you're often the first to see it. The more you understand about body systems, the more confidently you will report it. And now, learning equals better outcomes. The urinary system we just discussed, so I'm going to go past this one. And yes, we do have a free downloadable book on the 11 body systems. To actually access that free download, you will go to nurseeunice.com, which is at the bottom of the page. And so if you want to feel more confident during your class or exam, grab your free study guide packed with essential tips and key info to help you succeed. Again, this is going to be perfect for our CNAs, our PCTs, and or our nursing students. I need for you to understand the body systems, because when you're taking your test, some of you all are just so focused on passing your exam, you're forgetting that after you pass your exam, you're going to be taking care of sick people who have impaired body systems. So let's learn about them in advance. It is time, you all. Whoop, whoop, whoop. Let's get ready for your practice test. Find a quiet space so that you can focus. Have a notebook, a sheet of paper, a pen available. We're going to read through each of these questions, and I need for you to trust your instincts. You already have the heart for patient care. And I see so many of you all saying that you passed your examinations. Congratulations. If you have not passed your exam, you can send your test scores to admin@fltraining.com. Again, that is admin@fltraining.com. And we can send you a customized report in order to help you be more successful with your upcoming test. If you can also let us know how you've been studying and whether or not you've reached out to your instructor, because a lot of you all want to reach out to us first, and we need for you to follow the chain of command. All right, here we go, team. Question number 1. Which body system is responsible for transporting deoxygenated blood back to the lungs? Is it A, respiratory system, B, digestive system, C, cardiovascular system, or D, nervous system? All right, I see some answers coming through. That's right, put your answers in the chat. Ooh, we're torn between A's and C's. And so, which body system transports blood? Yes, it's C, it's the cardiovascular system, not the respiratory system. So the cardiovascular system moves blood through the body. So whether it's oxygenated or deoxygenated, if it's moving the blood, that's due to the heart pumping. That refers to the cardiovascular system. So it carries deoxygenated blood back to the lungs so that it can get more oxygen. So it's a continuous process. The heart and blood vessels do the transporting, not the lungs, the brain, or the stomach. And so CNAs help by checking vital signs like pulse and for watching for signs of poor blood flow like cold hands or swelling. Question 2. The skeletal system serves all of the following functions except A, protecting vital organs, B, producing blood cells, C, providing structure and support, D, filtering waste from blood. Great job, future CNAs and future nurses. Yes, it is D. So the kidneys filter waste, not the skeletal system. So that was the exception. Great job. Question 3. The largest organ in the body is which of the following? Is it A, heart, B, liver, C, brain, or D, skin? I I know this one's a little more tricky, but not for you. You got it right. Yes, it is D. It's the skin, you all. The skin is the largest organ of the body and is part of the integumentary system. Question 4. When measuring a patient's respiratory rate, which two body parts are primarily responsible for gas exchange? Is it A, heart and diaphragm, B, heart and lungs, C, lungs and alveoli, or D, sinuses and larynx? And I've done pretty well. I haven't had a cold in a few months, but I feel my throat getting scratchy. So I hope you all are taking care of yourselves, that you're taking your vitamins, of course, that you're also, washing hands a lot and using hand sanitizer. More importantly, if you're sick, stay your butt home. Don't go and get your coworker sick. That goes for my staff too. All right, so question number 4. This one was tricky. It is not B, heart and lungs. When we talk about gas exchange, it is going to be C, the lungs and the alveoli. So the alveoli are within the lungs and they allow the oxygen and carbon dioxide to exchange. So that is the true measure of respiratory function because if either of which are off, your patient can either be retaining carbon dioxide or their oxygen levels can be low. So we need a healthy balance. Even though that may be a term that may not be on your CNA test, I need for you to know these terms because remember, after you pass your test, guess what? You're going to be working and you're going to hear nurses and doctors mention terms like alveoli, and I need you to know what they're talking about. Especially when we ask you to use that incentive spirometer. When we say, hey, tell your patients to take a deep breath in, guess what we're trying to open? We're trying to get them to open those branches, the very bases of their lungs. We're trying to get them to open their alveoli. So I hope that makes sense. Question 5. Which body part is part of the central nervous system? Is it A, spinal cord, B, lungs, C, kidneys, or D, liver? And if no one else has told you today, I'm so proud of you. I am absolutely proud of you. You all keep showing up week after week, studying. I'm so proud of you. You're going to do it. If you haven't passed your test, you're about to pass your test. It's going to happen because we speak positivity over here. And question number 5, yes, it is A. It's the spinal cord. So the central nervous system consists of the brain and the spinal cord. Question 6. What is the main function of the digestive system? Is it A, pumping blood, B, removing toxins, C, breaking down food and absorbing nutrients, or D, producing hormones? And I need all 200 of you all who are watching right now to get this one right. Everyone should get this one right. Yes, it is C. The digestive system processes food, not produces food, processes food, breaks it down, and absorbs essential nutrients. And remember, digestion starts at the mouth. So if your patient isn't salivating, if they don't have a lot of saliva, if they cannot chew their food, so make sure your patients wet their mouths before you feed them. Make sure they have their dentures in. And if they don't have dentures, you probably want to let your nurse know so that their diet can be modified. Question number 7. The urinary system is primarily responsible for, is it A, removing waste products from the blood, B, circulating oxygenated blood, C, protecting the body from infections, or D, regulating hormones? And I know you're proud of yourself because you know this stuff. You've been learning your body systems hanging around with Nurse Eunice. So yes, it is A. We need patients with functioning kidneys so we can get rid of all the waste. So the urinary system includes the kidneys and it removes waste products and regulates fluid balance. So when someone has kidney failure, they end up on hemodialysis and we have a machine that cleans their bloodstream because their kidneys are not doing so. Question 8. A CNA observes that a patient's skin feels cool and pale after blood loss. Which body system is trying to compensate to maintain vital signs? Oh, this is a good one. Is it A, nervous system, B, muscular system, C, integumentary system, or D, cardiovascular system? You are absolutely right. Yes. Whenever we start talking about blood flow and compensation or decompensation, we are referring to the circulatory system, cardiovascular system, excuse me. So the answer is D. And again, the circulatory system is a part of the cardiovascular system. So the cardiovascular system constricts blood vessels to maintain blood pressure and perfusion or circulation after blood loss. Question 9. Which organ helps regulate body temperature by producing sweat when the CNA notices that the patient is overheating? Is it A, heart, B, skin, C, liver, or D, kidneys? That's right. Remove some of those blankets off of your patient. Turn that heater down a little bit because their body is trying to compensate with the sweat, and that's going to be controlled by the skin. So the answer is B. The skin and sweat glands release sweat to cool the body and regulate temperature. Let's go back. Pretend you didn't see that. Question 10. A CNA notes swelling in a patient's ankles and lower legs. This may indicate a problem in which system? Is it A, cardiovascular, B, integumentary, C, skeletal, or D, nervous? You see swelling in your patient's ankles and lower legs. What is the cause? What organ? What body system? And you are absolutely right. Yes, it is going to be the cardiovascular system. So edema or the swelling often signals poor circulation or heart failure in the cardiovascular system. Now, look, remember CNAs don't diagnose. So you can't see someone who has a swollen leg and be like, hey, you have congestive heart failure. It's not about that. It is for you to notify the nurse. And if we already know that this patient has a circulatory issue, a cardiac issue, what can you do to make this situation better without giving medications? Because that's not something that you do. So you would remind the patient to elevate their legs, maybe get them up and go for a walk. Remember, if they're just sitting there, that fluid is going to pull. It is just going to sit in their legs. And if they have those compression hose, those TED hose, you're supposed to put that on them before they get out of the bed. So while their feet are still in the bed, put those TED hose on. And we just don't let them walk around in TED hose because that would be a fall risk. It's going to be TED hose and either their socks with the little skitties on the bottom so they don't fall, or the TED hose and their regular shoes. Question 11. A patient with Parkinson's disease is having trouble holding a cup steady. Which body system is affected? Is it A, balance, B, muscular system, C, skeletal system, or D, nervous system? And remember, we're referring to the body systems. So which body system is affected? I tricked you. There's no such thing as a balance system. So it's not A. Give me another answer. That's right. It is D, the nervous system. So Parkinson's is a disorder of the nervous system that affects coordination, movement, and balance. And that's when you'll start seeing like your occupational therapists come in. They have different modified utensils that maybe someone with Parkinson's can use. And so the difference between physical therapy and occupational therapy is occupational therapists, they work with those fine motor skills such as holding a cup, holding a spoon, being able to feed yourself. A physical therapist teaches you how to walk again. Question 12. The pancreas plays a role in which two body systems? Is it A, endocrine and digestive, B, endocrine and circulatory, C, respiratory and digestive, or D, skeletal and muscular? And a lot of you all don't really know what the pancreas is, so I'll show you on the next slide. But what is the role of the pancreas? So when we say that someone has pancreatic cancer, what are we talking about? Or they have pancreatitis. So we need to know, once you hear those diagnoses, you need to know how it's going to impact your patient. And yes, for you all who chose A, you're absolutely right. So the pancreas kind of sits between the stomach and the liver. So the pancreas helps with digestion, and it helps regulate blood sugar by producing insulin. So usually if someone is a diabetic, it's because the pancreas is not producing enough insulin. And so you're going to hear these terms, you're going to learn them, and you're going to learn more once you go to nursing school. But let's get you past the CNA exam first. Question 13. A patient with renal failure will have difficulty regulating which of the following? Is it A, blood sugar levels, B, body temperature, C, fluid and electrolyte balance, or D, digestion and metabolism? What do we mean by renal failure? What has failed? You're right. So when we say a patient has renal failure, that's another way of saying they have kidney failure. And if someone's kidneys aren't working, what's not going to happen? You're right. They're not going to produce any fluid, aka urine. So it is C. The urinary system, especially the kidneys, is responsible for filtering waste by means of making urine and maintaining fluid balance. And so we talk about those electrolytes. If you're not urinating, but let's say you're drinking Gatorades, too much of anything is bad for you. So you can become toxic, or your body could become toxic, because now it's full of magnesium and potassium. And normally your body would be able to excrete anything that was excessive out. So if you take a whole bunch of supplements, your body's like, we've had enough supplements. It's going to produce urine, and then you're going to get rid of the additional. But if someone's not producing urine, but they're taking in electrolytes, well, again, too much of a good thing can become harmful, and it can cause their heart to start beating irregularly. So that is why we're really strict on what our renal patients can eat. And we usually tell them to limit their potassium and their magnesium, and also their phosphorus. All right, question 14. A resident with osteoporosis is at increased risk for which complication? Is it A, heart attack, B, fractures, C, stroke, or D, skin ulcers? Thank you all for studying with me. That's right. We have so many of our past CNAs who are now nurses. Some are doctors, PAs, respiratory therapists, business owners. So I just need you to start. So you're in a good spot. You're going to start, and you're going to grow from here. Question 14. If someone has osteoporosis, we know that their bones are weak. Therefore, they're at risk for B, fractures. Yes. Osteoporosis weakens the skeletal system, making bones fragile and prone to breaking. Question 15. What is the primary function of red blood cells? So if we say that someone has a low RBCs, you need to, first of all, know what RBCs are. So do the red blood cells, do they A, fight infections, B, clot the blood, C, carry glucose to tissues, or D, carry oxygen to tissues? That's right. I got you thinking about anatomy and physiology tonight. We're going to learn this. A and P, talking about the function of RBCs. And so red blood cells, that's right. They don't carry the glucose. That's not their primary function. Their primary function is to carry the oxygen. So it's going to be D. Red blood cells, erythrocytes, transport oxygen from the lungs to the body tissues. So that's why when your patients are anemic, when they have low RBCs, they're weak, their oxygen saturations could be low, because if they don't have enough blood that carries the oxygen, well, that's going to impact them. Question 16. Which organ filters toxins from the blood and produces bile? Oh, this one's a hard one. So let's write this one down. It filters toxins and produces bile, that green fluid. Would it be A, liver, B, kidneys, C, pancreas, or D, stomach? And this one's hard. So just give yourself a brownie point for even trying to answer this one. But if you answer it correctly, give yourself 2 brownie points. So revealing the answer in 5, 4, 3, 2, and yes, it is A. It's the liver. So the liver filters toxins, produces bile, and helps regulate metabolism. Question 17. A patient with multiple sclerosis, we call that MS, is having trouble walking and experiences numbness. Which system is under attack? Is it A, muscular system, B, nervous system, C, skeletal system, or D, circulatory system? Multiple sclerosis. Because of this condition, they're having trouble walking and experiencing numbness. So when you think about numbness, what are you thinking about? Is that cardiovascular? Is that circulatory with numbness? Or think about somebody who has like sciatic pain, peripheral neuropathies. So sometimes numbness can be caused by B. It's the nervous system. I know that one was hard. Remember, you get 1 brownie point just for putting the answer in the chat. Multiple sclerosis, or MS, damages the protective covering, the myelin of the nerves in the nervous system, disrupting communication between the brain and the body. So sometimes your patients with MS, especially if they're having exacerbation, they may not be able to walk, or they're not going to be able to walk safely. That's when someone like you comes in. You're going to have to assist them. This person was independent last week, but this week their body has changed on them. They're having neurological issues. And so just be patient with them and encourage them to be patient with themselves. Question 18. What is the function of white blood cells? Is it A, to transport nutrients, B, fight red blood cell production, C, fight infections, or D, aid in digestion? So we know that the red blood cells transported oxygen in the blood. So what do the white blood cells do? Yes. It is C. They fight infections. So WBCs are essential for immune system and fighting infections. Whenever someone has a low WBC or white blood cell count, they will sometimes end up on reverse isolation. Whenever we see that in labs, where sometimes we have to go ahead and contact the doctor that specializes in blood, a hematologist. Maybe the patient has cancer. Again, we are not trying to scare our patients, but when the nurse tells you this patient has a low white blood cell count, that means that you're supposed to do everything in your power to not contaminate them. And it may require that you end up gloving, gowning, and masking so that you don't bring anything into their room. Question 19. When assessing capillary refill, which body system is primarily being evaluated? Is it A, integumentary system, B, cardiovascular system, C, muscular system, or D, respiratory system? And if you don't know what capillary refill is, you will learn it on the next slide. And if you've been here for this long, if you've been here already for almost 30 minutes and you haven't made it official, I need for you to like, share, and subscribe. Tell a friend to tell a friend about Florida Training Academy and Nurse Eunice, because over here we help CNAs pass. We help nurses up their skills from IV therapy to phlebotomy. Look, it's not hard. You just need an educator. You need an instructor who cares. And that's what you have over here. So question 19, yes, the answer is B, the cardiovascular system. So in order for you to access your capillary refill, of course, you can't have any, nail polish that's going to prevent you from seeing your fingernail bed. So think about an older person, maybe a patient who is on hospice. When you touch their hands are cold. Those cold hands are a signal of poor perfusion. However, whenever you press on the fingernail bed, number one, the fingernail bed should already be pink. So if the circulation is poor, it won't be pink. So we're going to have you look at your own finger, and your fingernail bed should be nice and pink. I want you to press for at least a second. and then release. And you're going to count the number of seconds it takes to return your fingernail bed color from a pale to the normal pink color. And so that is what capillary refill is. So capillary refill assesses blood flow through the capillaries, which are part of the cardiovascular system. I won't give you more information because if I do, you won't be able to answer the next question without me already have had given you the answer. So at least I know you know how to check capillary refill. Question 20. The diaphragm is involved in which bodily functions? Is it A, digestion, B, urination, C, circulation, or D, respiration? The diaphragm. All right, we're learning new terms tonight. And yes, it is D, respiration. So with the image, you see the arrows pointing up. So between the arrows and what appears to be the lungs on this image, there's a line. It's kind of like a semicircle. That line is the muscle that sits beneath the lungs. Okay, so that would be the diaphragm. The diaphragm is a muscle that helps with breathing by expanding and contracting the lungs. So if somebody is paralyzed, their diaphragm won't move. And because their diaphragm won't move, and it depends on the level of paralysis, I do apologize. So let's say they're quadriplegic. Their diaphragm won't move. So guess what? They're not going to have effective breathing. So sometimes your patients who are paralyzed, we have to, help them with their airway. Sometimes they'll be intubated. And if you don't understand what these terms are, you're going to learn them as you go. All right, so question 21. Which organ stores urine before it is expelled from the body? Is it A, kidney, B, urethra, C, bladder, or D, gallbladder? So we know what the kidneys do. So which organ stores the urine? That is right, because most healthcare providers, they don't go to the bathroom often enough and they end up with stress incontinence because they never empty their C. They never empty their bladder. So the bladder stores urine until it is eliminated from the body. So make sure you drink good water, good amount of water, and make sure you go to the bathroom every opportunity you get. Question 22. We're almost done, team. Question 22. A resident with a history of impaction should be positioned in which way when receiving assistance with elimination? Now, what is impaction? You have to learn these medical terms to pass your test. Impaction is severe constipation. Right, so we got constipation, and then we got, this patient hasn't gone in 5 days type of constipation. So when someone is impacted, what position should they be in if they're trying to eliminate, if they're trying to have a bowel movement? Is it A, Sims, B, semi-Fowler's, C, upright or Fowler's position, D, prone? And let's break this down, team. When we say that we're putting someone in the Sims position, the Sims position is not for elimination. The Sims position is for an enema. It's for the nurse to be able to put something in the patient's rectum. So she would have you turn the patient to their lateral side, preferably their left side. You raise up the right leg, make sure the bed is padded. Your nurse will go in, she will give the enema. And then if the bed is padded properly and your patient starts to have a bowel movement before you come back with the bedpan, at least your bed won't get messed up. So the Sims position is not for elimination. It's for access to the rectum for medication. So, and then it wouldn't be D because prone is face down. How can someone have a bowel movement, someone who's mobile, if they're face down? So that leaves B or C. And do you want someone reclining when they're trying to use the bathroom who is impacted with a whole bunch of fecal matter in their colon? Absolutely not. So the answer is going to be C. We need them sitting up. Get them on that toilet. And if they can't get up to the toilet, get them to the bedside commode. And if they can't get to the bedside commode, put the bedpan beneath them and sit them up. It's not going to be comfortable, but hopefully it's going to allow gravity to allow some of that fecal matter to start coming out. So the upright positioning promotes better abdominal pressure and easier stool passage. Question 23. Which of the following body systems can be affected by stress? Is it A, nervous and digestive systems, B, endocrine and immune systems, C, cardiovascular and respiratory systems, or D, all of the above? How they say hypertension is a silent killer, stress is a silent killer. Because if you're stressed, your blood pressure is going to go up, your heart rate's going to go up, your hormones are going to be impacted. So whenever someone is stressed, it is D, all of the above. So stress can affect many body systems by triggering hormone release, increasing the heart rate, weakening the immune response, and disrupting digestion and breathing. Question 24. A nurse presses on a resident's fingernail and notes that it takes longer than 4 seconds for the color to return. Sounds like capillary refill, doesn't it? What does this indicate? Is it A, excellent circulation, B, normal capillary refill, C, normal skin turgor, or D, delayed capillary refill? So that patient you were worried about, their hands were cold, you checked the capillary refill, but you really didn't understand it 100%. You just checked it because you saw my video. And so now you have the nurse in the room and she has done the same. And she says, hey, it's taking longer than 4 seconds for the color to return. What does that indicate? And the majority of you are right. Yes, that is D. It's delayed capillary refill. Look at those fingertips. Look how mottled they are. That is MOTTLED. So when they become discolored like that, that's a sign of poor circulation on top of you checking the capillary refill. So here's our rationale. A refill time greater than 3 seconds, and remember for our scenario, the capillary refill was 4 seconds. So a refill time greater than 3 seconds suggests poor peripheral circulation and possible cardiovascular impairment. And we know what to do. Anytime we feel that something's wrong, if our patients had a change in condition, we're getting that nurse in the room. Question 25. Which of the following may increase a patient's risk of constipation or impaction? Is it A, opioid pain medications, B, regular exercise, C, high fiber intake, or D, a diet high in fruits and vegetables? All right, which is going to put your patient at risk of constipation? And you are right. It is going to be A, you all. It is opioid or just pain medications in general. So opioid slow intestinal motility. That means that it's not moving. They're laying down. Their organs are asleep. They're asleep. Nothing's really moving. Everything just starts getting locked up. Constipation can occur. So you're going to have to get your patients upright. Of course, if your nurse is giving someone pain medications around the clock, which normally we don't. When I was a nurse on the floor, if my patient, maybe they were post-op, they were complaining of a lot of pain, especially if it was an abdominal surgery, I would go ahead and draw up their medications. But we went for a walk before I gave them their medications, because when they start getting up and moving about, guess what? They pass gas. They start feeling better. They need less medication. So work with your nurse. Patients complain of a lot of, pain in the stomach. They probably need to get up to the bathroom, but it's going to be hard to get someone up to the bathroom if they're sedated from pain medication. All right. So guess what, team? I don't care if you're a housekeeper. I don't care if you're not even in nursing right now. You could be a cashier. Guess what? You can pass the CNA test. There is no reason for you to fail this test. A CNA is a great way to get you into the medical field. And then from there, you can decide if you want to do radiology, sonography, EKG, if you want to be a nurse. Look, this race is yours. You're only racing against yourself. Don't look left. Don't look right. Don't look at what anyone else is doing, because they don't have the circumstances that you have, and they may not have the family obligations that you have. So team, guess what? Remember that caring CNAs make caring nurses, and you're doing things the right way. You're learning communication. You're learning how to work with the nurse. And by the time you get into nursing school and you finish nursing school, you're going to be be a great nurse. Don't forget to like, share, and subscribe. And for our study buddies, look, we had a good review this weekend. So for our study buddies, I will see you online on Sunday night. I'll figure out what downloadable book I'll be getting you all this week, but I'll see you online this weekend. If you're part of our study buddies, it's only $4.99 per month. I think right now we have 2 different resources in there. We have 2 different member only videos. So if you want exclusive videos, or if you want to be, because we get hundreds of questions every day. If you want to have priority when you're asking questions, we need for you to join our membership group. Plus, don't forget that if you're a member and you want to appear live on camera with me, I need for you to email admin@fltraining.com, and I can send you a Zoom link and we can do a live review together. It could be a few of us. So let me know how you feel about that, you all. And thank you for watching. You know I love you and I appreciate you, and keep being amazing. I will see you in the next video.